So what are the symptoms of gum disease or periodontal disease? And are those the same thing?
Yeah, they're basically the same thing.
Okay.
Gum disease is, popular terminology. So bleeding from the gums is kind of the #1 sign. You might get some pain, although pain doesn't always show up, so you can't rely on it. But, you might say have a popcorn husk get stuck into the gum, cause the gum to swell. And then also odor. You might notice when you're brushing or flossing if you get a funny taste or a foul taste, and or even bad breath that's related to the same. And again, later on, if it's not treated, then you start to do things like mobile teeth, or even teeth fall out, or you get an abscess, which is like a swelling or a gum boil, they call it. So those are late stage findings, so you don't want to wait until you get symptoms. So what is it, by the way? I mean, it's a bacteria infection.
Okay.
Basically what happens is, think about it here. You've got something sticking out of your skin. Okay, let's say I broke my finger and I had the bone sticking out. How long would it be before that got infected? I'd give it a couple of days, right? So what happens in here is your teeth are sticking out of your gum. Why don't they get infected? Why doesn't bacteria use that tooth? Because it's not shedding, it's staying there. Why doesn't it use that to get in? Well, there's an elaborate mechanism of ligaments and blood cells and white blood cells that are there to protect the body from bacteria entering the system. Okay. But that's a constant battle because the bacteria don't go away. So the bacteria invade, the immune system fights back, you get redness and swelling. That's the classic signs of inflammation. So what happens is, over time, that process can lead to bone loss. So there's things that you can do to make it worse or better.
So what's the good news? I mean, what do you do in your practice to get rid of it?
You first have to recognize it. So you got to go through an exam. You got to get measurements done, and the hygienist or the periodontist is going to measure. You're going to hear, 2, 2, 2. Maybe that's the distance from the gum line to the bone, or actually the ligament, but that's what's called a pocket. And that's where the bacteria battle is going on.
Okay.
So as that measurement goes down, if it's 2 to 3, that's okay. 4 to 5 to 6 millimeters, that's a little bit like a moderate problem. And if you start hearing 7s, 8s, and 9s, or 10s, that's a big problem. You've lost 50, maybe 60 or 70% of the bone support on that tooth. So if you're going 2 to 10, you need to be doing something about that. Even if you start hearing 6s on a regular basis, you're at a time when treatment makes sense. And it's a lot easier to treat it early. So, I mean, the treatment can be as simple as just using freezing and getting a very good cleaning done, or it might involve what's called adjunctive antibiotics, whether it's done systemically or we use local delivery antibiotics in some advanced cases. And then beyond that, it can get up to surgery where we open the gum to actually see the areas. Because cleaning a tooth, it sounds simple, but when there's nooks and crannies and the shapes of the roots are there, you could take sometimes 15, 20 minutes just to clean one tooth. And if you could see what you're doing, you can be more efficient at getting it cleaned up.